Hello, everyone. Welcome to this webinar organized by the European Network on Independent Living together with Disability Rights International. Our webinar is called Children with Disabilities from Ukraine's Institutions. Where are they now and what will they return to? The role of international relief and funding in conflict and post-war recovery. We are very pleased to be organizing this webinar on the European Independent Living Day, the 5th of May, which this year is dedicated to children and youth with disabilities. And we, of course, would like to use it to raise awareness about the plight of children with disabilities in and from Ukraine. So we have a great group of speakers today. We are also really privileged to be able to hear from Disability Rights International, who have just returned from a fact-finding mission to Ukraine. So we will be hearing their findings, the findings from their new report. We will be seeing some video footage from their mission, and we will, of course, be hearing from other speakers working on the topic and to support children with disabilities from Ukraine. So very welcome to you all. My name is Ines Bulic Cojocariu. I'm the director at the European Network on Independent Living. And just before I give the floor to the first speaker, let me just say some housekeeping rules as usual. So we have today captioning. You can switch it on by clicking on the closed captions button at the bottom of your screen. You also have a link. My colleague will post a link in the chat if you prefer to look at your captions separately. We have with us two sign language interpreters, Natasha and Richard, who will be interpreting for us. Hi, Eric. We have interpretation into Ukrainian. So for all the listeners who prefer Ukrainian, please just choose Ukrainian, as well as when we have people speaking in Ukrainian, the rest of us who do not speak Ukrainian can choose the English channel. I think this is it for housekeeping. For the housekeeping, we have an hour and a half, so let's get started. I would first like to introduce, our first speaker, and this is Halina Kurilo. She is leading the work on Ukraine at Disability Rights International. And Halina will start us with the introduction on the situation of children with disabilities in Ukraine's institutions and present the findings of DRI's work there. So Halina, over to you.
Thank you, Ines, and hello, everyone. I'm very pleased to speak at this webinar. Could you please tell me if I'm heard all right?
Yes, we can hear you.
Okay, good. So just a little introduction of our work. I have worked in the Disability Rights International, DRI, since 2012. And as a part of DRI team, I helped lead a nearly 4-year investigation to document the conditions of children in the country's institutions. Together with the team of DRI experts, we wrote a report, No Way Home, about the abuse and exploitation in Ukrainian orphanages. I also worked in US State Department funded projects, and we developed recommendations to international development organizations to respond to the immediate and urgent needs of children in Ukraine's institutions. Both documents are available on our website. And recognizing the importance of the community service and family support to prevent institutionalization, DRI also trained and supported advocacy organizations of people with disabilities and family members with children with disabilities who are desperately working to keep the children out of institutions. So due to our extensive work monitoring institutions in Ukraine before war, we had a comprehensive understanding of how the whole system works and what are the problems and what they might be in the time of crisis. We were concerned that the children and adults with most complex disabilities and high care needs would be left out of evacuation effort as they were left out of the deinstitutionalization reform years earlier. From the very breakout of the war, we did first the desk and phone research, mapping out all the institutions under the Ministry of Social Policy and Ministry of Health. Those are places, as you might well know, where children with disabilities, I apologize for my own children at the background.
Don't worry, Halina, just go ahead, please.
So we mapped all the institutions where children with most complex disabilities and most complex needs were most likely to be found. And from this initial research, we found that institutions in general did not have any contingency plan for evacuation. And I mean not only war evacuation, I mean just generally institutions did not have plans, for example, for fire or for I don't know, any kind of a natural disaster. So those with most high care need children made a decision when the war broke out to shelter in place. Those are places like Nizhyn in Chernihiv region, Konotop institution in Sumy, 2 institutions in Kharkiv region, Oleshki in Kherson that is right now under Russian occupation, Ladyzhyn in Vinnytsia, and many more. Because of their high complex needs in terms of movement of these children and the accessibility of place that would host them, they decided that it was safer for them to stay in place. And then another finding was that institutions from the east, Donetsk region, Kharkiv region, Kryvyi Rih, among other city of Kryvyi Rih, were sometimes split during the evacuation, and those with fewer disabilities evacuated abroad, while those with more complex needs stayed behind in the institutions on the west of Ukraine. What struck us most from this research was that, especially at the beginning of the war, there was virtually no organized data collection of who went where, when, who stayed, and most important, who was left behind. There was no profiling of each child. And even though it does not come as a surprise, it was a common practice in Ukraine to count institutions and their needs rather than children and their needs. Ukrainian government officials, together with UNICEF, eventually did start to collect the data. However, from our conversation with UNICEF, we made a conclusion that these very institutions that I was mentioning earlier, those under Ministry of Social Policy and Ministry of Health, are still a blind spot to both government officials and the international relief efforts. While there was a detailed breakdown of movement of children that were in Ministry of Education institutions, those are institutions for children without disabilities or with very mild disabilities, small group homes, foster families, etc. Nobody had a clear picture of what is happening to children with most complex disabilities. And by saying clear picture, I mean the comprehensive picture. I'm sure that there was some knowledge about the numbers of institutions evacuated. Hence, our next step was the field research and needs assessment of the evacuated institutionalized children. And in the last week of April, and it was well into the 3rd month of the war, a team of DRI experts and volunteers spent a week in Zakarpattia region, visiting institutions, talking to their directors and staff, and also interacting with children. Our team consisted of Eric Rosenthal, the Disability Rights International Director and Attorney, Eric Matthews, MD, a child psychiatrist with extensive previous experience of monitoring Ukrainian and Georgian institutions, Marissa Brown, the registered nurse specializing in developmental disabilities, myself, I'm a social work and social policy professional, and Tatiana Birukova, a children's rights and disability rights activist. And so as from the composition of the team, you might see that we tried to create as much detailed needs assessment analysis as we could under the given circumstances. And we visited 4 institutions in Zakarpattia region. These are all institutions that have children with disabilities in that region. So all the institutions that are government run in the region for children with most complex and high care needs. Also, these are the same institutions that hosted children from the East, holding a needs analysis. And I would like now to show you a video compilation from our visits, because as we all know, a picture is worth 1,000 words. And then talk just a little bit to recap the findings. Ines, could you please show us video?
Yes, thank you very much, Helena. I will show it now. So I think this one. Right. So everybody should be able to see it.
It's April 2022, and the sound of air sirens reign on the streets of Ukraine. Disability Rights International brought a team of legal and medical experts to visit Ukraine's orphanages for children with disabilities during wartime, and found that Ukraine's children with disabilities with the greatest support needs are living in atrocious conditions, entirely overlooked by major international relief agencies and receiving little support from abroad.
This is a room of children who have been evacuated from, I believe, the Chernigov region. This was not meant to be a residential area, so the beds are literally pushed end to end. It's hard for the kids to get in and out of bed. The director apologized. He says he's had to turn away kids from other parts of Ukraine, that they're overwhelmed, that they simply don't have more space. He's making do. He wouldn't tell us whether he had more budget to deal with these kids. He said he didn't want to complain. It's a war. We do what we have to do. So no complaints from the director. They're making do with what they have. He said it would have been a lot easier just to say, no, we won't take these kids. But he's taking them. He's trying to make do. And here they are. Look at that. Look at how those legs. She picked the kid up and his legs did not move at all.
Years. Scoliosis, kyphosis. I mean, look at this.
What is that?
This is the spine is permanently damaged.
She said she needs additional staff because they only had staff for the children they had. She's ready to retire.
You are doing heroic work. Tell her.
There needs to be professional physical and occupational therapists who can evaluate these children and get them the proper positioning equipment, and to teach the staff the importance of getting the kids to move around. They're going to develop more contractures, even more severely depressed. This is not an environment that children should be facing living in.
They never leave their beds except to be washed. But as you can see, this is a line of beds completely lined up next to each other. It cannot be simple or easy to get in here and individually care for. There's no clear plan right now on where these children will go. This is the care plan.
Right. So this room is for the evacuees from the institution in the east. 14 people in a room, all in bed, no room to really get out or do anything. They seem to be in bed all the time.
I asked if they measure his head every day, and they said no. They had absolutely no idea.
And they also said it was recent and that they couldn't get treatment because of the war, but this is something that would have to have developed over a much longer period of time.
I haven't seen anybody with untreated hydrocephalus since the early 70s. With his head this size, it's certainly affecting his cognition, if not his vision. This is absolute abuse, not just neglect.
Everyone in this room transferred from Donetsk? Yeah. You can hear the sounds of the rhythmic chewing of the self-abusive behavior.
So now they have to assess individual needs of these children because they were just dumped on them without any instruction and any previous history of them.
Okay.
So she doesn't know what was happening to this child earlier.
You have a situation where you have one doctor, effectively, part-time, 2 days a week. When we ask the nurses, they're doing heroes work. They're taking care of these children, but with very limited resources and without much, if any, medical guidance.
Before the war, children in Ukraine's orphanages were cut off from loving care, health services, and their families. Since the war, the increased numbers in already crowded institutions have produced even more atrocious conditions. Immediate action is needed to identify where children are located in remote facilities and ensure they receive protection for their health and safety. To make this possible, there must be a commitment on the part of Ukraine's government from a policy of segregating children with disabilities to recognition of the right of every child to live and grow up in a family, as protected by the UN Convention on the Rights of Persons with Disabilities, which Ukraine has ratified.
Well, it is very difficult to see what we've seen. And I know that's one of the reasons why these children are hidden from the public eye and never considered a priority, neither before the war nor now. And what we found was that stress and trauma from this rapid relocation and challenges during travel, losing connections with their trusted staff, because the staff also had families that they had to get back to. So that all of us who evacuated rapidly from hotspots in Ukraine experienced, but for these children, when they were in an unfamiliar environment, that was twice, if not 10 times worse. So now they are safe from bombings, but now they are in overcrowded facilities with the bigger load on local staff. And in some cases, the lack of knowledge and experience of what needs they might have. Like 2 institutions that we visited in Zakarpattia were of level 2 profile, and who is familiar with Ukrainian institutional system, that means that they had children who were healthy and physically healthy and with a very mild or no disability at all. And now the staff of this institution that is used to only dealing with the mobile and children that are that can support themselves and they can take care of themselves. Now they're out of the sudden have to take care of kids that are that have very high and high care needs. And what was the worst part was that there was absolutely no individual analysis of needs and definitely not catering to them, because it was a common practice, even in pre-war times. In the wartime, nobody even paid attention to that. Even the fact that medical records were lost for 3 or 4 or even more days. I'm not sure how many days. The director was not clear about that, but the children were there. And the staff was left alone with these children, the local staff, not the staff that cared for them in the institutions in the East. And they were left without knowing what child has even what medical conditions, not to say anything about medications or any other rehabilitation plans. So if you're speaking about solutions a little bit, the war highlights everything, and good and bad, in people and systems in the country itself. And the war, in a good way, showed great compassion and heroic effort of our people, of staff in the institutions on the West that are accepting more children than they had capacity to and accommodating them and doing the best they can with what they can. However, these children, their needs are still neglected, even with this heroic effort, because it is physically impossible. It is impossible to provide proper care for a child in institutional setting. And I strongly believe that rules have to change, and we will not tolerate institutionalization of children in Ukraine anymore, because institutions in Ukraine are a leftover from Soviet era, and they should not be a part of free Ukraine. Every child has the right to be in the family and in the community. Thank you.
Thank you so much, Halina, for sharing this information. And like you said, the video was difficult to watch, but it is important to see as well. We will, I'm sure, we will hear more about DRI's report, and I'm sure we will get back to you during the discussion. Right now, I would like to introduce Mariana Onufric, who will share with us a little bit the perspective of families of children with disabilities from Ukraine. We're very happy to have Mariana with us. She is leading a local NGO in Ukraine. Mariana, please go ahead. It would be very good to have your views on children in institutions, the situation of families, what is happening at the moment. Please go ahead, Mariana.
Thank you so much, Ines. Hello to everybody, and thank you for giving me the floor. Of course, it is a little bit difficult to speak after this video we watched, and I would like to give my appreciation to DRI team. We missed you so much in Ukraine, so thank you for returning back. So I represent here the NGO Family for Persons with Disabilities that is located in Kyiv, Solomiansky region. And also I am a manager in SOS Children's Villages in Ukraine, and before the war, I was project coordinator of a big DI project for 5 countries. And I'm glad that among our attendees is Andro Dadiani, who also works in SOS Villages. And so I would like to tell you a bit about our organization. It is a parental organization, and it was established by parents of children with disabilities more than 21 years ago. We are a service organization. We provide social services in Kyiv. We have a daycare center for children with severe disabilities, and also we provide social adaptation services for youth. We had, or maybe we still have, a dream to open a house for independent living and to establish social entrepreneurship and so on. Among our members, most of them, yes, they are now in Ukraine. At the beginning of March, most of them went out of Ukraine. They were evacuated, but some of them came back, and also including Kyiv. So now in Kyiv we have 22 families. And 10 families are still in Ukraine, and about 20 families now are abroad. Me and as a head of organization and my colleagues from the board, we took active part in evacuating, in providing support to all the families in Kyiv, in Ukraine, and abroad. And also we receive a lot of proposals and many support from different organizations abroad, international organizations as a rule. And frankly speaking, all the time when I receive the request or the proposal to support us from international organizations or business organizations, I ask them, where have you been a few months ago, before the war, and where will you be after the war? Because the budget of our organization to provide services for persons with disabilities and the members of their families, it is also our a core business, one of our main tasks. It is about 150,000 hryvnias per month. And only from 8 to 10% of this budget were collected from or came from local budget, I mean budget of Kyiv city. As you probably know, in Ukraine there is no state financing. So from the central budget, it is impossible to finance social services. The other part, I mean, more than 90% of our budget, we gathered, we collected from business association, from charitable funds, donations, fundraising, and so on and so on. And it was very difficult. And I am afraid that after the war, and because we hope that it will end soon, it would be even harder because, you know, business, for example, one of our donor was a German organization from Germany, and it was closed at the beginning of this war. All the charitable funds now are working for helping our military forces. Persons with disabilities are not priority for now, as they never been, but. And so I strongly agree with Helena that we need to think now where our children from the institutions or family children, where they will come after the war. We need to develop services now, to think about this now. Because, you know, there is one more issue that, for example, all the families from our organization, up to 20, as I already told you, they are in the European country, and they receive good services, yes, educational services, social services. For them, these services are for free, or they are provided by volunteers and so on. You know that in Ukraine, it is not unlike in Ukraine, yes. So I'm afraid that after the war, our families, our children, that are the future of Ukraine, they won't be ready to come back to Ukraine if we won't develop services there. So I'm sorry, it's difficult to speak about this topic. So if I could help, if I could be useful, so please turn to me. I'm ready to provide you any information, or to provide you contacts of many organizations like our organization that provide services in Kyiv or all over Ukraine. And we have actually successful cases when parents took their children from the institutions and they received services at the community levels in our organization. So we are ready. Please, let's combine our efforts for the sake of Ukrainian children with disabilities. Thank you.
Thank you so much, Mariana, for this. With really an appeal to support families of children in Ukraine, children with disabilities in Ukraine. We know that support to families is the only way children will be prevented from entering institutions. And of course, the only way children from institutions can return to their families. as you said, there is a lot of attention on Ukraine at the moment, but it's so important that that attention stays on the situation of children with disabilities, and that funding, and there is a lot of funding around, there will be a lot of funding around, that it goes into the right places. So thank you so much for being with us. And I saw that some people are starting to ask questions in the chat and the Q&A box. So Mariana, as well, feel free to respond, or there might be some useful connections as well for you to make with people who are ready to support organizations like yours, and in general families of children with disabilities. So thank you so much. We will move to the next speaker. We will now hear from Maria Yastanovska, who is the humanitarian service officer at the European Disability Forum. EDF has been doing quite a bit of work to support people with disabilities from Ukraine. So it would be great to hear from you, Maria, in relation to children with disabilities institutions, what EDF is doing, whether you have any information to share, insights, or just in terms of what you think needs to be done. So the floor is yours.
Mm-hmm. Thank you, Ines. Thank you, Mariana and Galina. I'm have a very big impression after this video too, but previously I was in such institution and know a lot about the situation of children living in this kind of institutions. According to our activity as a DF, we are trying to coordinate our action with other stakeholders, and first of all with DRI, and we had some conversation about it, and of course with Ukrainian state authorities. And I think that maybe it's a moment to describe a little bit the Ukrainian legislation according to evacuation of children with disability from the institution. For this moment, Ukraine has some special law according to the evacuation, and inside of this law, Ukraine have a model memorandum between the text of the model memorandum between Ukrainian Ministry of Social Policy and the ministry in different countries, and all countries who interested in inviting children with disability can sign this memorandum with Ukrainian Ministry of Social Policy. And according to this memorandum, it's just one point about children from institution, and it means that children from institution will be better to stay abroad in the group. And it means that the privilege is for removing children from institution to institution, or different or other different form of residential care, not to family care. But it's not obligatory because it's just a model text. It's not a law. Anyway, each country can complete their own statement, their own memorandum with Ukrainian state in this sphere. And other very important things is to guarantee to give to Ukrainian government guarantees that all of these children will be returned to Ukraine when the war will finish. As we understood from our conversation with different stakeholders from Ukraine, Ukrainian state afraid to lose these children in different ways, and including international adoption too. Now we as a DF on the stage when we are planning our own activity in this sphere, and I will share with you our statement with this description of the situation of children from institution in Ukraine, and some our plans about it. And I want to tell you that, first of all, I think that we need to answer to Ukrainian authorities about these things which they afraid, and to show them that it's not so dangerous for children to get to family care. First of all, I think that international organization are able to organize the different kind of monitoring and data collection about the situation of Ukrainian children in different countries, about their rights, about their interests. Of course, in collaboration with Ukrainian authorities, first of all, Ukrainian Ministry of Social Policy and the National Social Service. The second, I think that we can give to Ukraine a good example how it's possible to organize family care for children from institution, because you know that another risk is to continue, to stop the institutionalization process in the neighbors country, like in Poland or in Romania, because when these children from Ukraine become into this country, and this country has this request from Ukraine to keep these children in institution, it's this is for this country, it's kind of an excuse to stop the deinstitutionalization process, and we need to prevent it somehow, and to demonstrate to all neighbors country and to Ukraine too how it's possible to organize family care in different way. And of course, we need to support Ukraine and to push the Ukrainian authorities to activate their process of deinstitutionalization and family care for these children when they will return to Ukraine after the war. We are thinking of organizing such things with our partners from Romania, from Poland, and I think that now we have a very good aim to push to our governments, to push to international donors, to support family care for children with disability in Ukraine, outside of Ukraine, and to sign this memorandum with Ukrainian Ministry of Social Policy, underlining family form of care of these children. I think this is all for this moment, what I ready to share. As I said, I will send you a link to our EDF document. And yes, for this moment, we are open to different discussions. Maybe just one thing which I can add. We talked with presidential advisor of the rights of the child in Ukraine, Daria Gerasimchuk, today. And she mentioned that 5 institutions in the eastern part of Ukraine need to be waiting for evacuation, and state authorities still have a lot of problem with evacuation of these institutions because they don't know the place where they can evacuate these children inside of Ukraine or outside of Ukraine. They haven't any request for hosting these children, and it's really difficult to evacuate them, including all of the things which you saw in the video. It means that it's children with the most complex disability. I will be ready to answer a question if you will have it.
Thank you very much, Maria. I'm sure, and I see there are lots of questions in the chat, so you feel free to engage with that. And thank you so much for sharing. It's so important that we, as the European disability rights organizations, engage in this situation. As you say, there are a lot of risks. There are risks to children who are in Ukraine. There are risks to children who are refugees, that they will continue to be institutionalized. There are risks to the processes of deinstitutionalization, which are already in any case not going very well around Europe, that we will end up with more institutions on both sides of the borders. So and yes, that there's also some potential of course putting pressure on the Ukrainian authorities to move in the right direction, supported in the right way by the international community. So thank you so much for that. Now we will bring in Marley Quinn. She is the Inclusive Humanitarian Action Specialist with the Global Protection Cluster and Humanity and Inclusion. And so Marley is coming from this humanitarian side, and she will tell us a little bit about how humanitarian actors can engage in this process of, let's say, supporting deinstitutionalization and in general supporting children to grow up in families and to move away from institutions. And in general to improve their situation at the moment. So please here you go ahead, Marley, the floor is yours.
Thanks, Ines, and thanks to all colleagues for having me here today. I really appreciate your time. So as Ines mentioned, I'm part of the Global Protection Cluster. I work for humanity and inclusion, and have been working to lead the Age and Disability Working Group under the Protection Cluster in Ukraine since the beginning of March. And I'm just going to speak very briefly on what humanitarian actors have been doing, specifically specialist humanitarian actors such as HI, HelpAge International and others, to support children and adults residing in institutions. I'll also speak to some barriers that we've been facing and that individuals with disabilities in institutions have been facing in terms of being able to access mainstream humanitarian support, and then also just touch on some recommendations for humanitarian actors and for Ukrainian OPDs and other specialist organizations in terms of how to engage better with one another with the ultimate goal of inclusive humanitarian action. So at the moment, I will say, and since the beginning of the war at the end of Feb, I will say that it's been well understood that those residing in institutions are most at risk of protection violations, and this is really clear. And unfortunately, what we've seen is, although many have been evacuated, those that have been evacuated, as colleagues have already touched on, face a plethora of new and renewed protection risks in situations of displacement due to lack of monitoring, lack of resources, etc. And the concern remains, of course, around those who reside in institutions and who are not able to leave because they have high care needs, etc. And there are not the resources in place to be able to support children in institutions who have high care needs and to be able to safely evacuate them and support them in situations of displacement. So what we're finding at the moment is local authorities being very cautious around supporting these kind of movements because safety throughout the evacuation pathway can't be assured. And also there is lack of space in the west of Ukraine and in other places, and lack of resources to support these children in situations of displacement. So they find themselves in a precarious and very dangerous situation because as a system, we're not able to adequately support them. In terms of the emergency response at the moment, we know in the East that there are actors who have been able to reach children and adults with disabilities residing in institutions who are not able to move. They've been able to provide emergency supplies, very basic, such as food, water, hygiene supplies, essential medicines. and we as a working group have been coordinating with wonderful colleagues at DRI and the Office for Coordination of Humanitarian Affairs specialist convoys to try and support the delivery of supplies into those extremely hard to reach areas that are not able to be accessed by traditional humanitarian actors at this moment due to the severe security risk. For those who are residing in institutions who are in relatively safe areas, there are significant barriers to accessing humanitarian services. I would say for those in institutions, they are typically not reached by humanitarian actors. I think that there is an understanding that possibly that those children and adults as well are being taken care of, etc., which is not always, the case, that resources are flush. And so children tend to be overlooked. I would say that particularly children who are not able to mobilize themselves, who are not visible physically in the community that they're currently residing in, tend not to be able to access humanitarian services. And that's really up to the humanitarian response to be able to reach these children. Should not be on the children to be able to reach them. So we're being very loud about this as a working group to say that it's our responsibility as actors to be able to reach those who are considered more difficult to reach. Communication barriers are significant as well. So for those people who are sometimes, including children, visible maybe in their immediate area, those who have difficulty hearing, those who have difficulty seeing with communication, etc., tend to report that they're not able to engage in humanitarian actors. And that includes those who have been placed in collective centres, other institutions, etc., in the west of Ukraine. And so this is a really important issue, really a point for advocacy as well for Ukrainian OPDs. And I know that much of the OPD community have been quite loud on this, but we continue to advocate towards humanitarian leadership to be more inclusive and to make sure that everyone is able to access humanitarian services on an equal footing. But we know also that for particular institutions, as other colleagues have already mentioned, resources are slim. Humanitarian actors have been providing financial support to support electricity, heating, etc. But we know that this is at the moment for short term. And we're hoping to be able to see lengthened commitments from humanitarian actors. And of course, this is always difficult, right? Because we absolutely don't support institutionalization. But at the moment, when there are very little other options, we are supporting where it is safe to do so, children in institutions, while there are other alternatives being sourced. So I would say, and just finally, I'll hand over back to Eric in a moment. The key issues for humanitarian actors at the moment and for organisations of persons with disabilities in Ukraine and further afield who are engaged on these issues, from my perspective, I think we really need to start thinking about data. I know that this has already been mentioned before, and we know that there wasn't great data and visibility on children residing in institutions before this war, and it continues to be a major barrier. I would say to those who are donors, who are trying to support humanitarian action in Ukraine, that we don't need data to know that there is a problem. So we need data, and we want our organisations who are engaging to start collecting data which can be disaggregated by disability, by difficulty, so we can report back to humanitarian leadership and start feeding the system with this kind of information. But I say in the same breath that donors should not be, particularly in this context right now, demanding data on children with disabilities to therefore fund proposals which seek to support children with disabilities. I hope that that's clear. And my final point is really around meaningful participation. With regards to the humanitarian system, we need to find space, we need to elbow out room for children with disabilities who are residing in institutions to have a voice within the humanitarian system. Aligned with the UNCRPD, humanitarian actors must recognise the evolving capacities of children with disabilities, and their opinions and their concerns must be raised to the highest level of humanitarian leadership. So we as a humanitarian system can program effectively and provide targeted and specific relevant assistance, not just through specialist organisations, but through all organisations providing humanitarian aid during this time and going forward. I will leave that there and remain available for questions. Thanks.
Thank you so much, Marley. We couldn't agree more on these points you've made. Just to highlight one point you said, it is really ironic how children and disabled people in institutions in general are considered to be safe, whereas probably they are the least safe. So the points you've made, of course, about the humanitarian actors paying attention to children with disabilities, in this case in institutions, is so important, but also on the voices of these children, which really we are not hearing at all in general, especially during the war. So thank you very much, Marley. Again, feel free to engage in the very lively discussion and answer any questions that you can. And here we close this part of the webinar, which is about the situation of children with disabilities in Ukraine. We turn a little bit to the post-war recovery and the role of funders. And here I would like to bring in first Eric Rosenthal, the Director of Disability Rights International, to share some concerns and recommendations in this regard. Eric, please go ahead. The floor is yours.
Thank you very much, Ines. We very much appreciate the folks at ENIL for co-sponsoring this and getting the word out throughout Europe. And I particularly want to acknowledge three of the speakers here, Helena, Maria, Mariana, Ukrainians themselves, all of who are staying focused on fighting for the rights of children with disabilities, despite the great dangers that they themselves are facing. We know that they have families in harm's way. Their friends and loved ones are being, bombed, attacked, killed, hurt, dislocated, displaced. And we've just been so amazed at the courage and resolution of our partners in Ukraine. My own staff, Helena, Olga, who I hope is listening in, 30 miles from the Russian border in the east, who can't get out herself, but has continued to do this work. You all inspire us to keep at it and to keep fighting for the rights of children and adults with disabilities. So thank you. Having spent years visiting these facilities and working to support and train activists, I never thought it could get worse. Those facilities were bleak, they were barren, they were dehumanizing before the war. And the idea that now they're getting even more crowded, they were stretched thin and neglectful, and now the children are being left in even worse and more overwhelming situations, that they've been moved suddenly in whatever contacts and with family left behind, even staff people who they may have formed attachments to, who went off to Western Europe and left them behind. The trauma that those facing, looking into the eyes of those children in that orphanage, in those orphanages we visit, was really it was really shaking to the core. And we must do something, and that's what we are here to talk about now. When we asked how it is that these children with disabilities could be left behind like this, the easy answer is that people with mobility impairments or nonverbal places, institutions where there was no place to go, it's hard to move children with disabilities. And all of those accessibility issues are the easy explanation. The harder, and to my mind, the truer explanation is that children with disabilities have been fundamentally dehumanized. They are not treated as full people. And that's what we need to change. That's what happens when you separate children from parents who love them and families, and you put them in these places. That's why these places are so dangerous. We asked the staff, they said, in a war, we're not going to complain when, our brothers are off fighting the Russians. But they also said, these children have no intellect. Those were the words they used. They don't know the difference. We keep them clean and we keep them clothed and we keep them fed. When we asked what they needed, they said they needed rubber sheets and more diapers. They need rubber sheets and more diapers, but they need a whole lot more. So what are our recommendations? Number one, these children need to be on the map. And that, as a human rights organization, that is what Disability Rights International has been spending 30 years and 10 years in Ukraine trying to do, to put these children on the map, to make the world aware of what is going on about them. That's why we go in with video cameras. That's why we go in and we talk to them and we write these reports. And we need your support in doing that. We need your support to make sure the rights and concerns of these children are simply not left off the table. And as Ukraine is flooded with international aid, there is more than enough money to meet the immediate needs of these children, but it's not getting to them because they are off the radar and not the concern of the major international responders. Even when it's easy to deal with kids with disabilities who've shown up in Poland, what about the children left behind? We've got to get these children on the radar. And that's what we are doing, number one. Number two, the generous and wonderful international relief agencies who we have appreciated working with so much, when we do point them in the right direction, getting immediate medical care, immediate health and safety and protection to those children is step two. We saw children with hydrocephalus, with a head larger than a basketball, untreated. We saw children, having seizures because of the trauma of the move and inadequate medications. I mean, immediate health, safety, medical reasons. That's number two. We've got to get to them, and we've got to make sure their immediate medical and health needs are met. But that is just the beginning. We know that once they're hosed down and clean, leaving them in those rooms, in those beds, is not enough. The institutional system of Ukraine must be brought to an end. Now, it's easy to say and hard to do, and we need to see a political commitment. What we need to see right now is a political commitment from the government of Ukraine and from international donors to work together on a transformation and a commitment to ending the Ukrainian institutional system. I asked an official with the US government, I said, look, are you making sure that US money is not going to rebuild institutions? Are you making sure that these children are not put back in institutions? They said, of course, we insist that these children be, integrated into the community. And we said, well, we had heard that children moved out of Ukraine were told by the Ukrainian authorities to some of the receiving countries not to integrate children into the community because they would be returned to orphanages inside of Ukraine after the war. We were told that this must have been a misunderstanding in the fog of war, that the Ukrainians couldn't possibly mean that. Now, we're in a delicate position now because we admire and appreciate everything the Ukrainian government is doing to stand up for the protection of its citizens and to fight off a totally unjustified onslaught at this time. The Ukrainians did not ask for this war. It was forced on them. But at the same time, they have had a system of institutionalization that has been dangerous, and it has been their policy to put children with disabilities in institutions. It has been, the children with disabilities were specifically taken out of the plans for deinstitutionalization a year ago. We and many of the disability organizations, ENIL and Validity and Hope and Homes for Children, many groups spoke out. The UN Special Rapporteur on Disability spoke out. The policy of segregation must come to an end. It is no longer acceptable. If Ukraine wants to be accepted as a democracy, and our support of Ukraine, our political support comes because we're fighting for democracy and human rights in Ukraine. Well, democracy must be extended to people with disabilities. It is no longer acceptable in a democracy to write off children with disabilities and put them in institutions. This is a violation of international human rights law. Every child has a right to live and grow up in a family. General comment number 5 of the CRPD under Article 19. That is a guarantee that Ukraine has ratified, most of the world has ratified. We must insist on it being enforced. Children who have, should not be returned to abusive institutions. Efforts must begin immediately. Now, people say to me, you are being totally unrealistic. The bombs are falling. We need to save them where they can be saved. Well, I was just in Western Ukraine last week, and I can tell you, in front of the orphanage, they were planting a beautiful plantation of gardenias and plants. They had a farm, an organic pig and cow farm where the residents were forced to work, by the way, whether or not they wanted to. They're trying to build, they're in the process of constructing new buildings with the expectation that they're going to be getting more people at that institution. So the orphanages right now have it together to start building new buildings with the expectation that money will arrive and that more patients and residents will arrive. Out in front of the orphanage, we saw the local government filling the potholes. If the local governments can fill potholes in the streets, if the orphanages can start constructing new buildings, if the gardenias can be planted, immediate efforts can be made to get children into families. What we are calling the international community to do is to develop a plan. We've learned a lot about how to do deinstitutionalization. And one of the core principles is the idea of the money follows the person. So the money should not go to the orphanages. Each of the needs of each of these children should be identified. There needs to be a multi-year commitment. This war may last a long time or it may end tomorrow, but the needs of these children are not going to be met with rubber sheets and diapers, or even medications for seizures and treatment for hydrocephalus. There needs to be a multi-year commitment, and we're asking every organization working on international affairs to commit to a program. The money follows the child. Give the children what they need right now. Get them stimulus, get them attention, get them some loving care, and get them into a family. And let's create a 3-year plan. And I believe that in 3 years, these children can be integrated into families, if not more immediately. But there needs to be a commitment. So all that international relief money that is pouring in where people don't know quite what to do, diapers are not enough. We need a commitment, and that needs to be a joint commitment by the donors and the government of Ukraine to end the policy of segregation. It is a policy right now in Ukraine. It needs to end, and that money needs to be contingent on a commitment to working together to have the immediate needs of these children met in a family. Ukraine will not be a democracy unless it protects the basic human rights of children. And we cannot accept a world in which those children are left to a slow death in those institutions. Thank you.
Thank you very much, Eric. I think you've set out really what needs to be done, answered a lot of people's questions. We know that money can make things happen, so let's hope that it can be used to motivate the government of Ukraine and also other European governments to change the system. These children are cared for in families. Our final speaker before I hand over to my colleague Dragana to moderate the discussion is Ines Ruskus, Vice Chair of the Committee on the Rights of Persons with Disabilities. We're very happy to have Ines with us. And Ines, for the very end, as our last speaker, is going to give us a little bit of a reminder of what is actually required of Ukraine and other governments in relation to children with disabilities when we have a situation like this. Ines, please go ahead.
Thank you, Ines, and hello, everyone. I would like to first thank the organizers of the webinar for providing time and space to highlight and discuss on children with disabilities in the condition of war, namely of the brutal Russian invasion against Ukrainian state and people. I do strongly believe Ukraine will defend its national sovereignty and as well as the democratic rule and sovereignty of its people. Democratic rule subsists only if all people are sovereign and possess fundamental human rights that can't be denied, including on the grounds of disability. In relation to this, I do believe that today is the right time to reflect on policies and practices to be prioritized and promoted in Ukraine. Within this context, the international human rights law has to be reactualized. The convention's obligations and human rights standards should be strongly promoted and fulfilled. Children with disabilities are under the scope of international human rights law. Through ratifying the two conventions of the United Nations, the Convention on the Rights of Persons with Disabilities, the CRPD, or the Convention on the Rights of the Child, the CRC, the states obligate to respect, protect, and fulfill the rights of children with disabilities, including and especially the rights to full social inclusion, to inclusive education, to family life, and support to family. The war has gravely affected the lives of persons with disabilities in Ukraine. May I remind that in March, during its 26th session, the CRPD committee has released its recall to the involved states, reminding them about their obligations under international human rights law, to take all necessary measures to ensure protection and safety of people with disabilities in situations of risk, including in armed conflicts and humanitarian emergencies. Within this call, the CRPD committee also remind about the obligations of the state parties to provide individualized support to all children with disabilities to ensure they are not separated from their families and are protected from institutionalization. And I would like to add, are protected from re-institutionalization, but provided with safe and loving family environments. As our discussion today demonstrates, the war denuded the detrimental situation of children with disabilities, especially those placed in institutions in Ukraine, and amplified the risk of their exposure to the life-threatening events, including abandonment, trafficking, abuse, or even death. I do remember the year 2015, I was a country co-rapporteur of the CRPD Committee for Ukraine after Maidan time and the beginning of Russian aggression, when the initial report of Ukraine was reviewed by the CRPD Committee. Within its concluding observations, the committee has expressed its deep concern about the institutionalization of children with disabilities in residential institutions throughout the country, including about the poor condition in institutions and reports of abuse and exploitation of children with disabilities there in institutions, the trafficking, reports of death of children with disabilities in institutions due to malnutrition-related illnesses. The CRPD committee has strongly recommended the state party to strengthen its effort to deinstitutionalization and to take measures to provide the support necessary to families with children with disabilities in order to guarantee children with disabilities the right to grow up in a family environment and the right to family life. After the examination of the report of Ukraine and recommendations of the CRPD committee, the situation of children with disabilities did not improve very much in Ukraine, as the follow-up reports the CRPD committee has demonstrated. But I do believe the time of peace and the time of recovering will definitely come to Ukraine. The post-war recovery time will also be the time for reinstating the democratic life in Ukraine, as well as it will be the great opportunity for refuting determinately the remaining practices that are discriminatory. Thus, it will be the time for transforming the discriminatory social institutions and its practices into creating the human rights and community-based inclusive society. The CRPD is a beacon on how the fundamental human rights must be fulfilled as regards persons with disabilities, including children with disabilities. As regards children with disabilities, the full recognition of the right to family life is of highest priorities, followed by full deinstitutionalization of all children with disabilities, and the provisions for their alternative care in a family, as well followed by community-based support to all families of children with disabilities. As you eventually know, in March 29 this year, the CRPD committee, together with the UN Committee on the Rights of the Child, has released a joint statement on the rights of children with disabilities. In this statement, both committees remind to the state parties of the convention about their obligations under CRPD and CRC to adopt the human rights model of disability, to take measures to eliminate all forms of discrimination of children with disabilities, including in situations of risk and humanitarian emergencies. Both committees has called on state parties to end institutionalization on the basis of disability, and to recognize the right to family life for all children with disabilities, to promote the support of children with disabilities in a family, in the community, to provide inclusive and supportive services for children with disabilities and their families in the community. May I remind that group homes are not the provision of the CRPD. Group homes reiterate the features of institutions that does not ensure children rights to family environment in any way and not to be implemented. Family life, including alternative care in a family, are to be promoted, supported, and implemented. Furthermore, on behalf of the CRPD committee, I would like to remind the state parties of the convention, particularly and the donors of Ukraine, about their obligations under Article 32 of the CRPD, that international programs that come to support Ukraine and will come to support Ukraine explicitly include the community-based support to persons with disabilities, children with disabilities including, and their families. And even more, that these programs are harmonized with the purpose and provisions of the convention, with the aim of full social inclusion of persons with disabilities, inclusion in the society, including and especially in preventing the reiteration of outdated and discriminatory habits and practices, such as institutionalization, through ensuring right to family life for children with disabilities, through the required community-based support to family, through promoting alternative care in families, and creating independent living opportunities for adults, persons with disabilities. The condition of children with disabilities must be considered as a form of independent, from the perspective of independent and inclusive life course. And for conclusion, I would like to say that re-institutionalization of children with disabilities must be prevented. Alternative care in the family and family life, community-based programs for children with disabilities, all children with disabilities, must be prioritized within the recovery response to Ukraine, including within the international cooperation programs that come to help Ukraine and restore democracy there. Thank you.
Thank you very much, Ines, for your presentation and for your continuous and committed work on promoting the institutionalization of children with disabilities and the institutionalization in general, implementation, of course, of the Convention on the Rights of Persons with Disabilities. First, I would like to know that and thank all the people for offering help. First place, we have had a very vivid discussion in our chat box, and we will try to address after all the major questions and thematic things that may require intervention, but also I think many questions were also answered in Q&A box, but I will try to engage our distinguished speakers just to maybe reflect on some of them. There was a question, and I think it's really important, that was posed by Georgiana Pascu. And I think that's something that we all are asking ourselves about. And Jonas, may I ask you please to respond to this, or at least give us your reflection. The question is, who is responsible for overseeing the rights of children in different countries? Is the Ukraine government informed how children are treated? So where is the, where is the liability? Where is the responsibility of monitoring of the rights of children who are now who have now left Ukraine and are in third countries? Maybe that would be something you can reflect on. Thank you.
I understand the question for me. Yes, there is. I would like again to recall to the call of the CRPD committee we made a few weeks ago to all states that are involved in that issue, that they are responsible, and there are obligations under international human rights law, including and especially under the CRPD, and governments are responsible for ensuring that human rights standards are implemented, are supported, and all governments know about it, about the detrimental effects and also of institutionalization, including of children with disabilities. They know because most of countries are already were reviewed by the CRPD committee, and we provided them with very clearly with the recommendations to end institutionalization, any form of institutionalization, including group homes for children, and to support families, to support alternative care in families. So governments are responsible, and so what is important to remind them, by including including through the international support programs, as I mentioned just before, because there can be, as it was mentioned before by Erika, the money will come to support will come to help Ukraine, and it is always to remind to the government and international donors that to invest money in rebuilding institutions is the big mistake. It is detrimental for people who will be placed there, and that is against human rights standards, and international obligation of the state. And what I mentioned and the other mentioned here, that if Ukraine aspired to be democratic state, I do believe Ukraine aspired for that. So rights of children with disabilities are under the scope.
Thank you very much, Jonas, and thank you again for joining us and for your committed work in promoting community life for all children and life in a family. There were a few more questions that I would like to address, and one is regarding very vivid discussion on group homes that we had in a chat. But before that, as I mentioned, and we are extremely grateful to all the people offering support. So there were many questions about how individuals can support children in Ukraine. What are the alternatives if we are not supporting institutions and group homes? And of course, support to families in Ukraine is what may be an answer. So I would maybe like to invite Mariana, if you would like to tell us what are the opportunities, how could maybe individuals from abroad help families and children with disabilities, either to return to their families or stay with their families rather than being separated and institutionalized.
Yeah, thank you, Dragana, for the question. I think that the most important now is to not to pay attention so much anymore to buy some essential goods or medicines or cash transfers. The most important now is to develop services at the community levels and to organize all the system to provide the best as we can for those who will come back to Ukraine, to Kyiv, to Kharkiv, and to other regions. This is the most important now.
Thank you very much, Mariana. Also, Eric, may you address this discussion that we had? Jonas has already mentioned the CRPD provision, and that General Comment number 5 requires that all children grow up have a right to live and grow up in a family. But can you address some other issues? For example, some people still believe that it's possible to replicate family environment in a group home. So maybe if you can reflect us why is that so, and if not, why not? Thank you.
Thank you, Dragana. Before I get to that, I'd like to respond. You know, since this report has come out and it was on BBC last night, we at Disability Rights International have been receiving an overwhelming number of people saying, what can I do to help? I'm concerned about the children of Ukraine. I want to help. Many professionals are offering their services. People are offering to adopt children with disabilities. Let me be clear. Number one is right now, adoption is really not an option. Most of these children have families. We're trying to clearly monitor where the children are going. And so the government of Ukraine has adopted a policy not to support adoptions at this time. That said, your knowledge, your expertise, and your concern are deeply, deeply important. It is very hard right now. Let's be realistic. You can be a trained social worker or professional in the UK or the United States, but it's very hard to pop off to Ukraine right now and offer that service. But what I ask you is to take your concern, take your love of these children, take your knowledge and channel it. Go to your elected representatives, go to your political representatives, and demand of your governments that international foreign assistance be made conditional on a change in policy in Ukraine to ensure family support of all children. There needs to be a powerful political message to Ukraine that the orphanage system will not stand. In tomorrow's democratic Ukraine, all children would be with families. And with the enormous influence of the international money, I believe we can have an incredible transformation in Ukraine. And to write to your agencies, if you're going to support an international relief group, diapers, rubber sheets, seizure medication are not enough. A long-term plan to support integration into families. So to all those people who want to help, let me say your political action is the most important thing you can do. And the second most important thing you can do, honestly, is that groups like ours, family organizations in Ukraine, human rights organizations like Disability Rights International, we are small organizations with limited funding. Every dollar, every euro you can give to our organization keeps us going. We did not have this Ukraine project in our budget. We have hired 4 Ukrainian staff members who are amazing at the drop of a hat to begin this work with no funding. We need your support to keep it going. If we can spotlight and keep the international attention on children with disabilities, on adults with disabilities, we haven't even begun to talk about the fact that there are many, many adults languishing in these institutions. We need to keep the spotlight on them. That's what Disability Rights International is trying to do. to keep them in the public attention, to make sure that wave of generosity that is the international relief effort gets to them, to make sure that when this war ends, we don't return to the segregated institutional system as normal. We need your support. Please give generously. Thank you.
Thank you very much. Thank you very much, Eric, for this intervention. We still have a few minutes left. There was a very specific question that I may like to pose either to Mariana or someone else working directly in Ukraine, and that was about children with ASL, and whether someone is supporting the children. Are there organizations maybe to that are working with children with ASL? If not, I mean, we can address this question also later if possible, but if you have a response, quick response, it would be much appreciated. If not, I would kindly ask our panelists to maybe give us a quick final words. Maybe we can start with Halina.
Thank you everyone for such a lively discussion in chat box and for all your engagement. And I believe we need to really think the bigger picture here, because while we care deeply about each child in the institution, and especially about those who we've seen, both on video and personally, but we need to think about the bigger picture and not to try to gloss over, as I said, to gloss over the bigger pain and bigger issue. If we do not stop institutions now, they will continue disabling the children. And there is no other way than to transition to community services slowly, as much time as it takes, as much effort as it takes, but the commitment has to be there, and commitment has to start now. This is the time. Thank you.
Thank you very much, Helena. This is a very important message. Mariana, would you like to give us your final message?
Yeah, thank you, Dragana. I think that now is important to combine the efforts of the stakeholders, because today the institutionalization, the DI, yes, gathered us together, and I think that it is important now to speak more loudly, and probably this is last chance for Ukraine, because you know that there were 3 attempts to start the DI, and I think that now during the war, this should be the last one, and it should be successful. Thank you.
Thank you very much, Mariana. This is a very, very important message that we should use this opportunity to rebuild.
Yeah, unfortunately, yes.
Thank you. Thank you. Maria, would you like to give a short closing remark?
Yes, of course, I can just agree with Galina and Mariana that, of course, war is a terrible situation, but it's a great opportunity to really change the system of child protection in Ukraine and to activate process of deinstitutionalization and family care system in Ukraine. And we need to use this chance on national and international level.
Thank you very much, Maria. Marley, may I please invite you to give us your final message?
Yeah, and I just popped it in the chat. I wasn't sure if I would have time, but just a huge thanks to ENIL and DRI for your work. This is incredibly important, and as a humanitarian actor, we're so grateful to have your expertise in this context to guide our work. Just a quick one for international organizations, particularly INGOs who have reached out to me bilaterally. I would say that the concern is at the moment that we will see fragmentation within the response. We need to really focus on supporting localization aligned with the grand bargain, etc. So the best way that we can really support an inclusive humanitarian response is partnering with local OPDs who don't necessarily have the current capacity to engage in proposal writing, etc., and to secure funds from some of the larger funds, for example, the Ukraine Humanitarian Fund. So we're really pushing and advocating for larger organizations to partner with local Ukrainian organizations to make sure that they have their space and they can access funding on an equal footing with others. Thanks very much, everyone.
Thank you very much, Marley, and thank you for your support and for all the collaboration that we've had throughout and since the beginning of this conflict. Jonas, would you please come in and give us your final message?
Yes, thank you, dear friends. Very happy to be here to discuss with you today. And I believe we need to work together. I mean, the CRPD committee, the civil society organizations, organizations of persons with disabilities, and governments to work together for the rights of children with disabilities. And I believe only working together and through following and adhering to the international human rights standards and standards of the rights of children with disabilities, we can make rights of children with disabilities a reality. Thank you.
Thank you very much, Jonas, and thank you everyone for your contribution to this webinar. At the end, I would like to thank our interpreters, our sign language interpreters, captioners. Thank you very much for your support to make this webinar accessible for all persons wishing to follow and participate in this discussion. Have a good day, everyone. Ines, would you like to? Oh, yes.
Just to thank everyone for participating and all of you colleagues at DRI and all our speakers, of course. And just to remind you that you will be able to find a recording of this webinar after it will be on ENIL's Facebook page, but we can also share it with all of you who registered for the webinar. And as I wrote in the chat, thank you for everyone offering support in different ways. We will share your offers with all the speakers in the hope that it may help facilitate some connections and maybe future cooperation. And with this, I would close the webinar and happy the rest of the Independent Living Day to everyone. And let's hope for the best for the children of Ukraine and work together to make sure that something good comes out of this and that some change finally happens. So thank you very much and goodbye.